be scanning the liver. I have a curvilinear probe. I'm just going to begin with my sweeps, starting at midline and swiping out for the left lobe. Take a deep breath in and hold. Starting at caudate, sweeping out, making sure there's no irregular contour, no abnormalities in the parenchyma, and then I'm sweeping over to the right and looking the right to make sure there's no abnormalities in there either. Alright. And then I'll be doing my transverse. You can breathe, and then I'll have you take another breath in and hold. Breath in and hold. So just going superior to inferior when I'm sweeping transverse. Starting outside of vasculature and sweeping down. Okay, good. Breathe. So now I'm going to begin my actual images. So just as I was during my sweeps, I'm starting midline. I'll have her take a deep breath in and hold. Starting at the level of the caudate lobe. And then sweeping out to about the level of the aorta, and then from there just about every 2 centimeters until I'm completely out of that tissue. And as I sweep out further, I'm just raising my gain a little bit because it starts to get a bit darker, and that'll be my last image right here. You can breathe. Now I'm just going to be taking my tip image of the left lobe. This is just to make sure there's nothing pedunculating off the edge. So here you can see stomach, that's normal. Nothing off the edge, so I'm going to take my representative image. I pet depth a bit just so we can really hone in on that edge there. And now I'm going to begin my midline to right sweeps. So I'm going back to that caudate lobe. Take a deep breath and hold when you're ready. I'm going to increase depth just a little bit. So we have caudate. I'm going to the level of IVC, and I like to increase depth a little bit more, just so we're really getting any tissue that's beneath the IVC. Then from there, I'm going to sweep out to the level of our main lobar fissure. And then continuing on out until we're out of it completely. Every 2 centimeters, taking an image until we've swiped out quite far. So I'll have this be my last image. Breathe. Next I'm going to be doing my liver kidney comparison. When you're ready, I'll have you take a deep breath in and hold. So you want the kidney to be isoechoic or slightly hypoechoic to the liver parenchyma, which we can see it's slightly hypoechoic. So I'm going to freeze and acquire that. And then I'm also going to be doing my liver measure. So this is a craniocaudal measure. You just want to make sure you're mid-clavicular, which I am right about here. So go ahead and breathe. I'm going to measure that as craniocaudally as I can. And I'm going to take one of those with and without measure. Next, I'm going to move on to my transverse sweep. So again, I'm starting at the left lobe of the liver, and this is going to be from superior to inferior, just as it was when I was sweeping through in the beginning. So go ahead and take a deep breath. I'm changing my frequency to go back up to Jen, increasing my gain, raising my focus up to the level. I'm cutting major depth because we're no longer looking at a whole bunch of tissue. This will be my first image, starting outside of any vasculature, sweeping down to the hepatic. And then down to the level of the portal vein. I'm cutting a little more depth. Then again, about every 2 centimeters until we're out of the tissue. You can see the pancreas start to come in here. And I think that last one could be my last image, but I'm just going to take this one as well to prove we're completely out of it. And now I'm going to be looking at the lateral edge here. Pretty much same concept as the tip. Just want to make sure there's nothing hanging off the edge. And take a small breath in, hold. So we can kind of lose the rest of that parenchyma there because we're really just focused on that edge. That looks pretty good, so I'm going to acquire that. Next, we're going to be doing our transverse liver, superior to inferior sweeps of the right lobe. So for this one, I like to be subcostal and a bit more lateral than I am with the left lobe, just so we can really capture all of that capsule. Once ready, take a deep breath in and hold. Switching to penetration so we can get better penetration in the tissue. And we're just going up as high as we can, trying to get out of all that vasculature. So I think this is a good spot. Just trying to get a little more of that border included. Alright, we're going to take that, and we're going to sweep down. I normally just sweep down to the level of the hepatics, but I think right here would be a good spot. And then we got the hepatics coming in, so I'll take that as well. And then when you're ready, take a deep breath. Now we're at the level of the portal vein, so I'm going to take that as well. And we can cut some depth here as the kidney comes in. And again, every 2 centimeters until we're just out of that tissue. Cutting more depth here. And I'll have this be our last image for our right lobe. Next, I'm going to go on to the main portal vein. You can go ahead and bring it. So for main portal vein, I prefer just normal respiration because it is a vein and it can, deep breaths can kind of impede the flow. I like to do an intercostal approach so we can really get it angled coming out of the porta hepatis. And this is a vessel that feeds the liver, so we are looking for pedal flow because it's coursing into the liver. So that's a pretty good, we got pretty good fill there, so I'm going to take that. You can see it coursing into the parenchyma and through the porta hepatis. So now I'm going to look for CBD. I kind of just stay in the same spot, angle around, see if I can find the CBD and elongate it pretty good. So I can see CBD. Just trying to see if I can elongate it a little better. And I liked what I saw before. So I'm just gonna go ahead and measure it there. It got cut off. Just gonna search. Find that spot again. And here you can see it pretty well. I'm gonna reduce some gain. I'm gonna take an image before I measure it, and then I zoom in, and I'm gonna measure the thickest portion, which I would say is about here. So I'm just doing an AP measurement. I'm gonna make sure it's bucketed, which it is. So I have 0.16, you want it to be less than 6 or 7 millimeters. So that's within normal limits. And next, I'm still gonna stay intercostal to try and get her hepatics. And so for that, I'm just gonna angle up slightly higher than I would for the portal vein. You can kind of see them coming in here. I'm gonna throw color on. So we can see the right and the mid coming in nicely. So I'm just gonna take that. Ooh, I have to change my label to right and mid. And then to get the left, I'm just gonna go back to where I was for the transverse sweep. Change that label to left and mid. Proof that I am getting left, I want to make sure I include mid in this image as well. And here I'm going to have my subject do a deep breath in and hold. And this will be our last image. So again, I'm sweeping down. So here we can see our mid coming in. And our left. I'm going to turn down gain a little bit. And there we have it.